Hello, everyone. Thank you all for joining the Alumni Society today for the latest installment of our Microlearning Series, which provides actionable advice and insights from members for members. I'm Christina Merrill, Member and Community Engagement and Communications Manager at the Alumni Society and a proud graduate of Columbia. Today, I'm happy to welcome member Norma Padrón. Norma is the CEO of EmpiricaLab. Norma, thank you so much for joining us.
Thank you so much, Christina, for having me. I'm excited about today's conversation.
It's great to have you with us today. So let's go ahead and dive right into our questions. So Norma, tell us a little bit about yourself.
Yes. I'm trained as a PhD health economist. I worked in academia. I always describe my professional journey in sort of like three phases. The first one was very academic. I did research in health services research, design, population health, disparities research, and that took me into the world of big data and collaborating a lot with data and technology teams within health systems. And so in 2016, I left academia and started working in what I call the second phase of my professional journey. Very focused on data analytics, very focused on large-scale initiatives, building data products for health systems. I was Senior National Director for Data Analytics at the American Hospital Association. It was an amazing opportunity to learn how healthcare systems across the country really use data, the challenges that they have, both on the measurement, reporting, improvement, operations. And it was a very eye-opening experience that I'm very honored to have had. And it launched me into the third part of my career, which is very focused on technology. I was in the new ventures team at Anthem, now Elevance, where I had the opportunity to work very closely with our incubation and acceleration programs. So really partnering with early stage digital health companies, our large employer groups, national provider groups across the country, and really thinking about technology adoption was happening in healthcare. Which was then what really motivated me to start my own company, EmpiricaLab. And I'll tell you more about it. But so yeah, this third phase of my career has been very focused on technology adoption at large scale organizations, enterprise organizations in healthcare.
That's an amazing career history. Thank you so much for sharing. Yeah, let's talk about EmpiricaLab. What does your company do and who does it serve?
Yeah. So the problem we saw, or the problem that I experienced almost from different angles, was that healthcare enterprise organizations are huge. They're very complex organizations. We work with some partners here in New York that have over 24,000 employees, over 120 sites, so different facilities. The types of workforce that interact in these organizations is also really complex. It includes business and operations, so your standard, accounting, admin, but also really complex clinical operations as well. So obviously clinicians, nurses, as well as operating staff. So the operations staff are folks that are highly specialized in the operations of this type of facilities, require a lot of training, require a lot of following guidelines in order to operate at the levels of quality and safety that they need to operate. And so the big problem that we saw was that information management, knowledge management, and training in these highly complex organizations, it's a problem that hasn't been fully digitized at these enterprise organizations. And so EmpiricaLab is a solution that is a cloud-based layer that leverages data and information wherever it lives in their cloud, using data analytics and yes, a little bit of AI. We actually surface information for them in real time. So we actually surface for them where training gaps may be happening. We give them analytics reports in terms of compliance and training across the life cycle of these employees. So from onboarding to compliance training to continuous education and requirements that they need to be compliant with, to even project-based type training that happens in a more fluid way. So by doing it in this way, we make sure that everyone in these enterprise organizations has the right training at the right time. This is a problem that healthcare systems in the US spend over $4 billion annually. And so it's a problem that we're excited to tackle, leveraging the latest technology and making sure that this workforce that has experiences so much burnout, frankly, such terrible software in prior iterations of knowledge management and training management. And so we're excited to provide a more empathetic and better solution.
Amazing. Big responsibility for sure, for sure. And what was your motivation for starting this company?
Yeah. So my first generation, I feel that like many in our audiences, training, education has always been something that is so core to us. We value education a lot. We value training a lot. So I think on a personal level, I'm very grateful to have the opportunity to be in a space that is so specialized, so niche, right? In a way, but that it is about workforce development, that it is about preparing the workforce for what they need to know today, as well as how they need to be prepared for tomorrow. On a technology level, I speak about this often. I was someone who, when I was writing my dissertation at Yale, I started with a data set that at the time was so big. I had 5 million observations, over 20 years. And I remember that, as I started from the time I started, by the time I finished, computation had become so much more accessible. Like you could run all your regressions in your laptop. And so I am a technology optimist. And so I think that training, and specifically the role that workforce development has, so the role that employers have, is super crucial as we embark in this new wave of technology adoption that we're all so excited about.
Amazing. Amazing. So tell us about the landscape of healthcare organizations.
Yes. And I think this is an important point. When I mentioned that I'm a trained economist, that I work in healthcare and have a technology company, sometimes folks are a little bit of like, how does it all connect? So just a little bit of the landscape, when we think about the ecosystem of healthcare in the United States, we always hear healthcare is about 20% of the GDP. It's a huge expense, costs are going up. And so we hear sort of this, the experience, I think we've all can relate, it's a little bit complex. It's hard to understand. Sometimes it's not the best. And so we know that very well. What people know less about is just the, kind of what it takes to deliver care in the US. So we have over 21 million workers in the US. It's one of the largest groups of workforce that we have. And yet we have such incredible staff shortages. We hear about on the nursing and the clinician side, but we also have staffing shortages when it comes to, again, the operations and business side of the house, and certainly on the technical side. As a workforce, it represents over $1 trillion in annual payroll. And then when we think about the landscape of organizations, there are about 1,600 health systems. It represents over 6,000 hospital sites. We, in addition of that, have critical access hospitals that deliver care in rural parts of the country or in hard to reach parts of the country. Fairly qualified health clinics. Obviously, if you live here in New York City, you have as well as urgent clinics, walk-ins. Of course, you have now, the big players in pharma. So we have like Walgreens and CVS also entering sort of like minute clinics. And so the delivery of care kind of happens at different layers in the landscape and the ecosystem. It is a place where I think that there's a lot of opportunity for improving. And it is a place that, another statistic perhaps that I think is important for the audience to know, it is a place that is going this profound transformation in how work happens. Who is delivering care? How are they experiencing their day-to-day operations, their day-to-day work? According to the Bureau of Labor Statistics, we have over 500,000 employees within the healthcare sector quitting every month. It's not a typo. It's not a mistake. Every month. And it doesn't mean that they leave the workforce altogether, although you do have a big proportion of the workforce leaving the healthcare sector altogether. But it does mean that all of these places that I mentioned where care is happening, they're experiencing this huge staff turnover. They're constantly having to make sure that everyone knows what they need to know at the right time, that everyone is properly onboarded. For you as a patient, you might be interacting in a place where you're talking to someone who is their first week at that, in that location or in that facility. And so there's a lot of opportunity to make sure that information management, knowledge management, and training kind of happens in a better way. They certainly are undergoing just a profound transformation when it comes to work.
Amazing, amazing. And what is the status of these organizations? Where would you say are they thriving and where are they hurting?
Yeah. So for the last 2 years since I launched EmpiricaLab, I've had the, obviously tremendous opportunity to talk with executives across the country, particularly when it comes to their data and technology. So chief data officers, chief information officers, technology officers, and those teams that are at all of these different parts of the ecosystem, working towards, really leveraging technology and data to make the experience both of workforce and patients better. What I'm optimistic about is that across the board, I think that everyone is being very intentional. They're not only aware, but they're being very intentional about how can they improve the experience of work within this organization. So workforce, I think that is taking sort of such a front row into the conversations at C-suite level in these organizations. It is about attracting and retaining talent. It is about being an environment where people actually want to work and stay. Technology plays a big role in how they experience that, but also hybrid arrangements. You hear a lot perhaps about traveling nurses. Again, like we heard about that because there's a clinical part of the house, but there are similar types of movement into more, I guess, flexible work arrangements when it comes to admin and operations. And so it makes me optimistic that it doesn't seem to me that they're not aware. In fact, like they're hyper aware of the sense of urgency about how can we make the experience of working in these organizations better. I think there's also an acknowledgement that this will make them much more competitive, right? So it becomes an opportunity for them to be the organizations where this type of workforce wants to work, and so it makes them competitive in delivering better access and better and safer care. I think that one of the challenges continues to be that technology adoption, precisely because these are organizations that are called high reliability organizations, right? Small mistake can have huge repercussions. So they're a little bit risk averse when it comes to adopting newer technologies. And so I think that some of the challenges are navigating the challenges is that the transition into digitizing electronic health records, which happened throughout the 2000s, right? It took a long time to get us there, but we have 99% adoption of electronic health record across all the ecosystem that I mentioned, right? So that was huge. It took us a minute, but we got there. The latest part of adoption of technology for them has been the move to the cloud. And that has run much more successfully and much more smoothly. I think that across the board, when I talk to, information teams or technology teams, data teams in these organizations, the move to the cloud has been much more smoothly. I think that, the big players on the space, obviously you have Microsoft, you have Google, you have AWS, have made a point in having very specialized type executives in their organizations that actually can provide very customized support to life sciences and healthcare enterprise organizations. I think that when it comes to, we're all very excited about generative AI. We're very excited about the potential that it offers into, making the experience of work better, information, management much better. I think that that's an opportunity for them. I see them kind of trying to strategize around it. But I mean, I think it remains a challenge about the speed of adoption of newer technologies. So excited about that. They're very intentional about the workforce. I think cautiously optimistic about their willingness to engage quickly with, technologies as they come to market.
Incredible, incredible. And in your experience, what skill sets do healthcare organizations need the most right now?
Certainly it cannot be understated the challenges that they're currently happening when it comes to clinical side, to clinical workforce. And so I think that that the skills around, delivering care when in the nursing space or, clinical space, I think that again, they simply cannot be understated. And so I would encourage, in our audience that for those that want to pursue those careers, I think that is definitely an avenue where there's a lot of need and there's huge opportunities to develop those skills and come to market and work in these organizations. What I'm seeing perhaps as, what I call the future of work, in these organizations is this reconfiguration into the teams in how these teams operate into delivering care. So one specific example would be that, now when we think about diabetes management, there's actually a lot of, remote monitoring devices, continuous glucose monitoring devices, a lot of data analytics and sensors that can happen in the remote monitoring space. And so what I'm seeing is this reconfiguration into what I call the sort of like the digital layer, the IRL layer, and the technology layer, for the delivering care. So again, going back to my days working in, within the American Hospital Association, so when you think of service lines, you're thinking about, configuring the optimal amount of, care, and how does that team looks like to deliver care to large populations. Diabetes continues to be one of the biggest problems in the US when it comes to chronic conditions. And so organizations are thinking, and they're doing it today, thinking about the sort of like, again, the technology layer, the digital layer, and data layer, and then the IRL. And so I think that there's this huge opportunity for those with technical skills. So, your engineers, software developers, data analysts, AI experts coming to market, and then really incorporating into part of the team across this continuum of these 3 layers: technology, data, and IRL, care delivery, that now delivers an amazing experience for patients. It increases access because now you can leverage these layers, the technology and the data layer, to do it remotely, increases access and a better experience. And these folks are very much part of the team, so you might have trained as a software engineer, and your day to day, and if you cared about having impact, might be about advancing diabetes care and access to better care in the US. Again, huge problem. So I think that the way we think, about who in the team, what are the skills in those amazing teams, leveraging these 3 layers: technology, data, and clinical care, clinical and person care. I think that there's this huge opportunity to bring people with technical skills into the space. So for those in the audience, I'm always open to talk and encourage men and women to come into STEM fields and work for something that has such impact in our communities.
It's great to know that, regardless of what skill set you have, you can put it to use in just so many different creative ways. You don't have to box yourself in. I love it. I love that example of a software engineer. So thank you for sharing that. And what would you say are the stakes if we don't have these roles and or skill sets?
Yeah. I mean, I think that we know the statistics, right? So Hispanic communities in the US continue to have the highest amounts of uninsurance in the US, despite the Affordable Care Act, despite many states in the US, expanded Medicaid. Sometimes our issues around access or about interacting, what are our points of contact? Again, the Hispanic communities continue to report high rates of not having a usual source of care. This means that on a day-to-day, when it comes to prevention, when it comes to management or early detection and early diagnosis, Hispanics continue to not have access. And so I think that the more that we bring, folks that look like us, that speak our language, that understand our culture into the space of delivering care, the higher the chance that we have to improve access into Latino communities across the country. I was born in McAllen, Texas, where, if for those in the audience who might remember, there were several articles in the New Yorker by Dr. Atul Gawande on how this tiny spot in the country has some of the highest expenditures in care, some of the highest rates of uninsured. I grew up without health insurance. I didn't have health insurance until my 20s, right? And so I think that there's this huge opportunity, and really what's at stake is that if we don't engage in this part of the economy, we're not only advancing the economy, but we're also not benefiting our communities. And so again, there are many skills that are needed to actually make it function, and there are many skills that have, I would say, like broad applicability, that if you trained in the STEM fields, if you're an engineer, if you studied math or statistics, medicine, if you went that route, there's so much gap into the access and the experience of care for Latino communities, that I think that those are the stakes. And so I would definitely hopefully inspire others that regardless of your skills, you can come to the field, and it's moving so fast and there's such gap in opportunity that this is a space that really needs us.
Amazing. And an amazing bit of personal history there. Thank you so much for sharing. That's very powerful, those types of anecdotes. So thank you. So let's switch gears and let's dive into AI, because it's such a hot topic. How are you thinking about how AI might impact healthcare organizations?
Yeah. So I was mentioning that obviously I've been in healthcare for a minute. So I think my first peer-reviewed article was in 2009. So I'm not saying my age, but people can do the math. But I think that what has been perhaps again in this moment today, what has been excited is that through the different waves of, as computation was growing and increasing in access, Moore's law, like computation actually is moving fast and continues to do so. The skills that were needed to adopt sort of like, or to engage as machine learning, big data was coming of age and becoming more accessible, you actually required a lot of training. When I finished my PhD and, I wanted to be more of a data scientist and learn about it and train myself, it took me a minute to learn R and Python and, banging my head against the computer, get my code right, or, access to the data. The next, like I mentioned, when it comes to specifically healthcare data, you hear a lot of this word of interoperability. Are the claims data speaking to the other parts of the data that we have within healthcare organizations, right? And some systems are not interoperable, and so problems and challenges with data. And so again, if you wanted to be an analyst, if you wanted to work in the space, it required a lot of specialization. It will take you a year or two to get very familiar with those data structures and how they work and the challenges and things of that sort. I think that in this wave of technology, when we heard about generative AI, the thing that probably gets me the most excited is that it is in its own right an exponential technology. And by this, I mean that not only is the technology really amazing, it leverages foundation models, it leverages like a lot of computation power and techniques that are very sophisticated, but it actually doesn't take you that much to learn. So it is exponential as well, in the way that if you start playing with it today, in a couple of weeks, probably you'll be able to build your own GPTs, or you'll be able to know how to do the queries and start using it in ways that are beneficial to your day-to-day. And I think that engaging with these technologies is something that I totally encourage folks to do. You see, again, the big players, launching co-pilots into some of the enterprise software that we love and use every day, like Microsoft Office. Obviously, I'm very excited about their recent announcements when it comes to co-pilots. And so I think that what gets me excited about generative AI in specific is that it has the potential to transform adoption of technology across the skill set. You don't need to be a statistician to use it. You don't need to know about machine learning and the depths of it to, perhaps use it for summarization or again, for some of the tasks that you do today. And it can bring value. And there's research, amazing research coming out that, for example, some of the spaces that it is seen that is bringing a lot of really really valuable sort of support is in onboarding, actually. And so you have newer employees into a new task. It could be in the customer service space, or just new tasks in administration or operations. And so having this support in a conversational way, again, which is just how we speak, you don't need to be coding complex structures. That's the opportunity there. And so I think that what gets me excited, and I know that obviously we have to be cautious, we have to understand some of the fundamentals that are always applicable whenever analytics are involved, that data could be biased, that we need to be wary of it and how we trust it and how we think about it and what we use it for. But I think that the opportunity that it has across the board and the speed at which we can adopt it, it's something that gets me very excited. And certainly, again, in my conversations with healthcare executives, when artificial intelligence, which has been in use for many years, in the vision space, even in audio space, again, this was used for imaging, radiology, for really kind of understanding perhaps how in images, cancer cells were happening or not, and predictive models around like cancer development. And so I think, again, you have to be really specialized in prior, years, even though it's been around for a minute. But so now with generative AI, I think we have this huge potential that everyone could benefit from it.
And on that note, when it comes to AI, how can Latinos in particular stay ahead, especially those who work in the healthcare industry?
I think that the first step is, so really understanding your organization, how is it being used and approved or not. So I think on the day-to-day issues around data security, obviously data governance, are top of mind for this type of organizations. And so I will say, like, learn how your organization is thinking about it. Volunteer, because what I can tell you is that a lot of organizations today are drawing their 1 year, 2 years, 3 years strategies. And so it's an amazing opportunity to raise your hand and be part of this transformation that your organization is engaging. On your own time, I will definitely say start using it, start learning it, use some of the open source models, get familiar with it. I wanted to speak a little bit of kind of 4 categories that AI can be used, or generative AI as we know it today, could be used, and could be used for tasks that you perhaps have. Again, could be simple as, if you need to send an email, or perhaps if you're reading a specific type of training and you need to summarize it. By the way, this is something that we do in our platform at EmpiricaLab as well. But sort of these 2 super categories. I always say that one of the things about generative AI or just AI in general is that machines are really good to talk to other machines. And so if you are in the software engineering, software development space, or just sort of if you're a developer, code generation, code review is something that generative AI could do today. There's certainly a couple of even open source tools that you could be using where, like I was mentioning that when I was training myself to learn more about data science, and, training in machine learning and using Python, code was like, you'd had this tiny mistake or something, your code is not running well. So code generation, code review is something you could be doing today. Of course, like in enterprise organizations, if you are at a healthcare organization, perhaps you're at a technology organization today, but you want to learn more, enterprise organizations generate a lot of content. They have a lot of guidelines. They have a lot of information. So search and knowledge retrieval. So conversational search. So something where I have a question in this space, where would I start finding, or like, tell me a little bit more about this based on the knowledge that is based on that enterprise. So search and knowledge retrieval is another category. Of course, summarization and expansion. So that's one that I use a lot and I like it a lot. When you have to go through very long documents and you just need a synthesis of this. We use it as well in our platform, like I was mentioning. So if you're thinking about care navigator training, if you're thinking about onboarding, sometimes you need like chapter summaries, memorable quotes, checklists, you just need like a summarization or an expansion. So you sometimes have like specific type of paragraphs and you're trying to draft this longer document. Generative AI as it stands today, the models that we have out there in market can really give you a first good draft. And so that's an excellent way to sort of like, again, expand or summarize content. And I think the last one, which perhaps for those folks that are interested in digital marketing, communications, graphic design, digital asset creation. And again, there are a few tools out there that I would encourage everyone in the audience to start getting familiar with, start understanding. Don't be afraid. And even in your, if you're in your own time, on the weekend, start playing with it. But yeah, so those are the 4 super categories that I think that, alumni society audiences should be engaging. So code generation, code review is one. If you're in the development, software development space, search and knowledge retrieval, that, when you're trying to get to the information as faster, as quickly as possible. Obviously, we see a lot of chatbots in that space as well. Summarization or expansion of content. So when you want to synthesize content or expand it, if you need to send a long email or long letter, and of course, digital asset creation. So those 4 super categories. Super happy to talk to anyone in the audience that might be interested. But yes, Latinos should be part of this amazing wave of technology that, like I mentioned, we're so excited it's accessible to all.
Amazing, amazing. Norma, thank you again so much for being here today and sharing your insight. You have some truly great experiences in this area, so thank you for sharing your wisdom. Quick question, how can members get in touch with you?
Absolutely. So my email is norma@empiricalab.com. You can reach to me on LinkedIn. I might take a minute, but I always respond to my messages. I am always excited to talk to folks in, executives in other organizations who might want to talk to me about sharing our insights and lessons learned from EmpiricaLab, but also others that might be interested in just knowing about the space, building your career. So I'm always here for the community, and thank you so much, Christina, for having me.
No, we appreciate you very much. So thank you. To our audience, if you are interested in sharing your knowledge and insights in an upcoming Microlearning Series webinar, email us at members@thealumnisociety.com with your idea. Thank you all again for joining us today, and have a great rest of your week.
Thank you so much.